We are so excited to be at the Health 2.0 conference of 2023 in Las Vegas, Nevada. Please introduce yourself and the organization you're representing today.
Hi guys, my name is George Savvides. I'm from Quickmed Diagnostic and I am the Vice President of Lab Operations.
Amazing. You are a Health 2.0 Conference USA Summer 23 honoree. Congratulations.
Thank you very much.
How did it feel to receive recognition for your accomplishments?
Of course, incredibly grateful. It's not often you get recognized for the work that you do, especially when you have your head down. I think the acknowledgement is obviously incredibly gratifying and something that I'm proud of. I think putting the hard work, the dedication, and obviously with a strong emphasis on leading my teams and helping them come along on the journey and giving them responsibility and accountability has obviously led to this award. So I'm incredibly grateful for that and proud, to be honest. I think a lot of stuff that we've implemented in the organization was bold and out of the norm. And to be recognized as such a prestigious event is obviously incredibly amazing. It's amazing. And I'm grateful to my team, the people that nominated me, and I'm really proud to be in this position.
Yeah, amazing. What advice would you give to someone wanting to follow in your footsteps?
I think, in my opinion, and in the way in which I lead, I think the first thing I would say is be curious. It's incredibly important to ask questions and to not feel like you shouldn't be able to impose yourself on a certain topic or idea based on other people's opinions. I think take a growth mindset, that goes along with being curious, of course. And I think also being able to network and bring people along with you on the journey and pull people up. I think leadership is often perceived to be one in which you have to lead from the front, and I agree with that. But I also think there's a difference between leading with empathy and with compassion. I prefer to lead with the latter. And I think for future leaders that want to take the path that I've taken, I think also being able to communicate clearly is incredibly important. To communicate the vision of the organization, communicate the mission, why we're doing what we're doing. And the thing that I learned a lot was to include people in the decision processes, have people actually contribute, not only the managers, but the people at the lower tiers of the organization, because they feel a part of the entity. There's nothing better than feeling part of a combined goal that everyone's driving towards. And I feel like if you deter or defer from that, you often find yourself in precarious situations.
How has your learning and networking experience been so far at the Health 2.0 conference?
It's been good. I think focusing on the networking facet first, it's been great. I think I always enjoy coming to a conference of this nature where you meet people from different walks of life, different industries. And the main thing is that why we're all here is to focus on the improvement of health and the ability to identify new solutions, new technologies, new education tools to help not only educate the people in which we are serving, but the industry as a whole. Because I do believe that the health industry, it is ripe for innovation. There is a lot of innovation going on. And I think conferences like this brings people together for a common goal. And the last thing I would say is one of the talks that I did enjoy was a panel discussion by Kerry Officer from UMass, which is a child healthcare institution where they create a platform for patients to communicate with other patients that are going through the same kind of scenarios. And one of the examples she gave was a mother that before giving birth to a child, they were able to actually diagnose the child in the mom's womb that had congenital heart defect, where prior to the baby's birth, they are already connecting the mother with other mothers that have gone through a similar approach, educating them with simple information that helps them understand this, and actually creating a platform for them to feel accommodated and ready for what's about to come in the next steps once the baby is born.
That is so amazing.
Yeah, it was really cool.
Where can others reach you for collaboration and advice?
I think that the typical social media channels, LinkedIn, of course, on the professional landscape. Of course, I have an Instagram account under my name, George Savvides, and I'm also the chapter director for Startup Grind Los Angeles, which is a global community of entrepreneurs where I connect communities in the health space, in the tech space, and yeah, that's where you can reach out to me.
Amazing. Being a South African leader in the USA, knowing well the impact another famous South African, Elon Musk, has had on various industries, do you take inspiration from him?
Yeah, I think naturally being a South African, you typically look towards an individual like Elon Musk as inspiration. I mean, he's obviously gone on to do incredible things, and I wouldn't say that I'm trying to follow the path in which he's done or emulate him. What I do is use him as inspiration to also encourage me to do things that I think he's done. And what I mean by that is piercing the veil, going against what society has often depicted as something you shouldn't be doing. And what I mean by that is the ability to send humans to Mars, is what he's doing. And obviously with Neuralink now, more focused on health tech, where they're going to create this technology, or they're already creating this technology to help people with neurological defects, to help them communicate with their body. So with Elon Musk, of course, being a South African, it's amazing. He's probably the most influential person in the world right now. But I want to sculpt my own path and create my own legacy. And I think, obviously, being a South African, I hope I can inspire others along the way.
Absolutely. Where do you see the future of healthcare, and what excites you the most?
I think what excites me the most right now is remote patient monitoring. And actually, Kerry Officer from NUMAS spoke about that, where remote patient monitoring is obviously a thing, and it's improving with the proliferation of health tech and telemedicine. But what excites me the most is obviously the introduction of artificial intelligence and AI, where I think with remote patient monitoring, in the past, doctors would have to send patients home and not know what is going on with them. But now they'll be able to get real-time information and analysis on that patient's data and leverage that data, which will become the grassroots of AI to create solutions for future solutions.
Amazing. Well, it's been such a pleasure talking
Thank you
with
so
you
much.
today.
I appreciate it. Thank you so much. I appreciate it.